Tailgate Talks with the University of Nebraska Beef Extension. My name is Sydney O'Daniel, and today I'm going to talk to you about reproductive management and some ways you can minimize early pregnancy loss in your cow herd. As we approach the breeding season, cows and heifers are faced with a variety of stressors from caring from their calf, changes in environment such as transportation to summer pasture, and pregnancy diagnosis. It is well documented that stress during early pregnancy can cause early embryonic loss. The embryo is most vulnerable from day 5 to 42 post-breeding. From days 0 to 4, the embryo is still in the oviduct and fairly protected. However, when it migrates down to the uterus, it is susceptible to changes in the uterine environment, which can be as a result of stress. At day 42, the embryo has implanted into the uterine wall and placentation has begun. This is a time when the embryo is a little bit more protected from changes in the uterine environment. There are a couple management strategies you can utilize to minimize early pregnancy loss. First, let's talk about transportation. Transporting cows and heifers between days 5 and 42 has found to have a 10% increase in early pregnancy loss. This study was conducted at Colorado State University, and they found that the recommended times for transporting cows and heifers are before breeding, days 1 through 4 post-insemination or breeding, and after days 55 to 60. Some losses have been reported between days 42 all the way out to day 60, so waiting a couple weeks after day 42 may be advantageous. Next, let's talk about heat stress. Heat stress is also another factor that can contribute to early pregnancy loss. Making sure that you're transporting cows and heifers, or even working them in more moderate temperatures, can help you maximize your pregnancy rates. Finally, let's talk about pregnancy diagnosis. While pregnancy diagnosis is a great tool for sorting your open and pregnant females and is often economical, it can also be a risk to early pregnancy loss. There are 3 methods of pregnancy diagnosis, from a blood test to rectal palpation and ultrasound. A blood test is often not as useful, as you can't get a result immediately as compared to rectal palpation and ultrasound. But let's compare rectal palpation and ultrasound real quick. Rectal palpation is a little bit more invasive and is very dependent on the skill of the technician doing it. You feel for landmarks when you palpate, and oftentimes that can disrupt the embryo in those early developmental stages, and rectal palpation is actually found to have a 2-fold increase in early pregnancy loss as compared to ultrasound. So ultrasound is your best bet, but with a skilled technician, rectal palpation can be a useful tool as well. Research by Colorado State University found that skill level of the technician doing the pregnancy diagnosis had a significant impact on early pregnancy loss, with novice or inexperienced technicians having a 2-fold increase in pregnancy loss. Now, let's talk about timing of pregnancy diagnosis. Research at Colorado State University found that pregnancy diagnosis prior to day 53 had a 3-fold increase in pregnancy loss. While early pregnancy diagnosis is often economical, you also have to weigh the risk it might have with actually causing pregnancy loss and reducing your overall pregnancy rates. If you have any other questions, please contact your local beef extension educator, or visit the Beef Watch archive for more articles, or visit the UNL Beef Repro website. Thanks.